We are now recording. Thank you everyone for joining us. I'd really excited to have this conversation with Jessica. This is such an important topic because of the incredible work that child care providers are doing to support essential workers throughout the state. Jen Gerber, who will be interviewing Jessica. Those who don't know Jen, probably many of you do. Jen is a lead partner here at SVP of the DOMIS team. She's an SVP board member, and her background includes both for-profit management consulting, nonprofit management, and she has also served as the president of a family foundation. So we're really thrilled to have Jen in all of her many SVP roles. And with that, I will turn it over to her.
Thank you, Sky, and good morning, everyone, on this somewhat dreary Thursday morning. I just wanted to sort of set some context here. I think as many of you are aware, SVP is increasingly engaged in the early childhood space here in Connecticut. We are working with individual nonprofits such as Child First, supporting its home visiting program for the most vulnerable. We are also working with All Our Kin, of course, where we're supporting technology and organizational development, and also where we're currently trying to support their needs during this crisis, and where our very own Don Kendall serves as a trustee. At a state level, we are also working on the Governor's Workforce Council, where access to quality childcare has emerged as a key lever in workforce strategy. And we're also actively considering how and where to support Connecticut's early childhood system in our strategy work. Given all of this, we are especially fortunate to have Jessica Sager here with us today. Jessica is, as many of you know, the co-founder and chief executive officer of the aforementioned SVP nonprofit partner, All Our Kin. I will let Jessica tell us a little bit more about All Our Kin in a minute, but I just wanted to take a moment to share some more about Jessica. Jessica also co-teaches a Yale University seminar on childcare. And she has many accolades, but to name a few, she's a New Prophet Extraordinary Social Female Entrepreneur. She's a recipient of the Rosalind S. Jaffe Award Grand Prize and the Ashoka Changemakers Robert Wood Johnson Champion of Children's Wellbeing Award. She is also a Parara Aspen Institute Education Fellow. This current crisis has really underscored the critical importance of childcare in our system, as Sky just mentioned. So the demands on Jessica's time are really great right now. And in fact, just last week, Connecticut's Commissioner of Early Childhood volunteered how grateful she was for Jessica's thought partnership and leadership during this time. So Jessica, we just want to thank you so much for making the time today to speak with us. And without further ado, we would love to just jump right in. And our first question for you is could you just give us a little more background, particularly for those that maybe aren't as familiar with it, about the All Our Kin model?
Yeah, and before I do, I just want to say quickly how incredibly valuable SVP's partnership has been to us throughout our growth, really over the past 3 years, but also how SVP has stepped up to support us during the COVID-19 crisis. And just to let you know that it means the world to us and makes a huge difference in our capacity. You know, I used to say the childcare system in this country was broken, and then I realized that was giving us too much credit. We don't have a childcare system, and sadly, this was true even before COVID-19. There's no kind of systematic approach across the country or even in our state to supporting the needs that families have to find care for their children. Even families who have plenty of disposable income and work 9 to 5 have trouble finding care. But if you are a family with an infant or a toddler, a family working non-standard hours, if you have challenges around transportation or paying for care, it becomes almost impossible to find quality care for your little one. And so what happens is that across the country, mostly women open their homes to care for each other's children. These family childcare educators play a critical role. I mean, truly, our childcare system, such as it is, would not function at all without them. And yet, for way too long, policymakers, have sort of left them out of all the plans around how to think about childcare in this country, and frankly have assumed that what they're offering is not education and cannot be quality care. At All Our Kin, what we do is we take the opposite approach. We invest in family childcare educators, and we bring them the very best of what we know about how children learn and grow, as well as the best tools for succeeding as business people. And the result is really transformative. We build high quality family childcare businesses that can support the families who are the furthest from opportunity. And we do that in 4 main ways. The first is our licensing initiative, where we help childcare providers meet health and safety standards and become part of formal systems of care. The second is our strength-based coaching and learning, where we truly bring the best of what we know about children's development and adult development to help family childcare educators excel as teachers and classroom leaders. The third is our business training, helping family childcare educators build businesses that are sustainable and provide livable support for themselves and their families. And the fourth is connection to all the host of community resources that can help families and children to be successful. So really building two-way bridges to everything that exists in community. The result of these combined efforts on our part is that we've made a significant impact on the supply of care, the quality of care, and the business success of our family childcare educators. So in New Haven, for example, All Our Kin existed for about 10 years before we expanded to other places. And during that 10-year period, we saw family childcare programs across the state decline by over 30%, while the supply in New Haven increased by over 70% because of our efforts. In terms of quality, we have really rigorous external evaluations that are widely cited in the field, demonstrating that our educators score on average over 50% higher on research-based observational tools that correlate with better outcomes for children. And All Our Kin children outperform peer and national norms on language and literacy, problem solving, and social emotional skills. Finally, our educators are likely to stay in the field longer. They will probably earn $5,000 more after 1 year with us, $10,000 more after 2. And the combined impact of our work on provider earnings and parent ability to enter and stay in the workforce results in a return on investment of $15 to $20, according to the University of Connecticut, for every dollar we invest. But really what's important is that our work is a triple win. It's a win for children who get wonderful early care and education experiences at the times when their brains are literally being built. It's a win for parents who can go to work every day and feel good about where their children are cared for. And it's a win for family childcare educators who can do the work that they love and make a decent living doing it. We began in Connecticut. Connecticut is still really where our heart is. We have offices in New Haven, in Bridgeport, and in Stamford, serving the Stamford-Norwalk area. And we're also providing support in Hartford, in Danbury, and other parts of the state as well. We have an office in the Bronx, and we've begun to train others in our model.
Thank you, Jessica. That's helpful context. And I think you could probably say right now, I don't think it would be an overstatement to say that it's also really a win for the citizens of Connecticut right now, because it's these family childcare providers who are providing care for the essential workers, which is supporting all of us right now. So this is very important work. And given the current crisis, how has this impacted the family childcare network specifically, and how has it impacted your work?
Yeah, so, as I said at the beginning, our childcare system, such as it is, was fragile to begin with. And I think there's a real potential for this crisis to shatter it altogether. So I think we need to think about two things. We need to think about the current moment, and we need to think about what comes afterward. So first, the current moment is excruciatingly difficult for children and families, right? Obviously, particularly those with the fewest economic resources, and it's excruciatingly difficult for childcare businesses. The majority of childcare businesses, both centers and family childcares, cannot sustain a closure of 2 weeks or more, and that's what many of them are facing. Most of the centers in the state have closed. They're gone. Will they be able to reopen? We really don't know. In terms of family childcare, more of them are staying open. And I think in many cases, that's because they are serving the children of essential workers. And it's also because they feel such a deep commitment to their communities. And I do think there is some reason to think that family childcare is a good option to look at right now because of the small group size. And because, again, so many of them are still serving the children of essential workers and remain open. That's about 60% of our programs that are still open, by the way. So remember, 40% are closed altogether. But for those who are still open, they're facing incredible challenges. First, just economically, they don't have as many children coming as they did before, right? And they recognize that parents are experiencing economic hardship. So often they're collecting reduced fees from those parents who are coming, or for example, in the case of subsidized parents, they're waiving copays. So economic hardship is number one. Fear of their physical safety is another, and I think it's a really real challenge. Our family childcare educators are struggling to find things like paper towels, hand sanitizer, basic cleaning supplies, tools like disposable thermometers that they can use to screen children safely. And they need better information and support. They need better public health information. The CDC finally just released specific guidance for childcare centers, but it's been a real uphill battle to get that kind of public health information. And where it exists, it often is really impractical to implement in family childcare. So getting folks really specific information and guidance, getting folks supplies, and getting folks connected to things that can help to stabilize them economically, those are all key priorities for us. And I'm happy to talk more about what any of those things are, but just quickly on the economic side, for example, I think making sure that family childcare educators know about and are applying for all the forms of federal and state relief that are available to them. We've talked a little bit about that, I know, with partnering with you guys on that, Sky, but I can say more about some of those challenges. We have set up an emergency relief fund of our own, and we are fundraising to be able to get some dollars out to these programs. In terms of health and safety supplies, I mean, we are literally chasing them down. Like, we had someone approach us. He runs a factory. He's willing to give us hand sanitizer that he's manufacturing, right? So we're getting those things out to programs. We're talking, for example, to medical students at Yale about what kind of consultation they can provide, as well as talking with the state about what kind of nurse consultation they can offer. And then the last piece is that family childcare educators are caring for children who are experiencing trauma. And I do not want to minimize that, right? These are the children of essential workers who are really scared and confused by what is happening to them. And so our own educational coaches are providing support to family childcare educators around how to support and care for those children effectively. And then they're also connecting our family childcare educators to other resources that exist. So we have a lot of national partnerships, and we're able to make a lot of those materials available. And I'm happy to talk more about those as well. In the long term, I think my fear is that, again, we're going to come back and find that the childcare infrastructure is absolutely gone. And what took years to build has been so unraveled that as we try and restart our economy, parents have nowhere to put their children, right? And so the work that we're doing to stabilize programs now isn't just with the open programs, it's also with the closed programs. Beth Bai, the Commissioner of Early Childhood, to whom you refer, has been an amazing partner. She has made a commitment to keep childcare subsidy dollars flowing to programs that are closed. That's essential. Those programs have to be able to reopen on the other side of this. Again, helping our providers think about leveraging the resources that exist so that they can stay open, so that they can meet their basic needs and feed their families. And finally, family support, because even the programs that are closed, they're still doing Facebook Live sessions with kids. They're still leading circle time. And in both cases, open or closed, they're also connecting families to a huge host of resources, from food banks to energy assistance to really everything that exists in communities. They are those trusted messengers. I will pause there, but I do see that there's a question about the challenges with the PPP and the EIDL. I would be very happy to speak about those, or I can pause, Jen, if you wish, and then segue into those later.
You can definitely go ahead and answer that question right now, and then we can continue on.
Yeah. Okay. So yeah, this is really important. So I'm assuming many folks on this call know, but I don't want to assume universal assumptions. So two of the big forms of relief that exist right now are through the SBA. So the Paycheck Protection Program, which is fairly substantial, forgivable loans to help businesses stay open and keep folks employed. And then the EIDL, which is smaller but is quicker, it's disaster relief funding. So first, let me talk about the PPP, because I think it's a tremendous resource, and we know that folks are really banging down the doors to get this money, and we want our family childcare educators to be at the front of the line. So one challenge with both these sources of funding are that the applications are have not been quick to come out. They have been changing. Even having the latest information is very difficult. So getting that information into providers' hands. But the PPP, I think the biggest challenge is that the funding flows through banks, not the SBA. That means that all our kin, or SVP or another organization that has great banking relationships and a robust business checking account, that's the kind of organization that's going to be prioritized. If you do not have a business checking account, many banks will not work with you. They just won't. Even if you say you use personal checking, right? If you need a lot of technical assistance, banks are less eager to work with you because they just don't have the resources to help you fill out the documents. I saw a note in the chat about Peoples and Webster. I agree. They have been really fast and eager to engage. But if you're not a Webster customer, and again, if you don't have that business checking account, it can be really hard to get in. So we're super concerned about this. And I think, we're really looking to CFDIs and other institutions that might be willing to step up to see what kind of role they might be willing to play in this situation. And I think talking to philanthropy about, say, stepping forward and offering to guarantee some of these smaller loans or pay for technical assistance would be a really helpful and important role to think about. And if any of you have strong relationships with a banking institution, to talk with your bank about how to do this, I think would be really wonderful. The EIDL, we are at the beginning of this process. I think folks just being able to gather the documentation is key, but I think we can support our providers in doing it. We have a long waiting list of folks who are looking for our advice on how to get this done. And so just making sure we have the staff to provide the support to folks to get the paperwork together and in the door is another challenge. The last thing I will share that I think you should be aware of is that there are many people in this state who do not have documentation. And for them, I think being able to access resources, everything from the stimulus checks to both of these sets of loans and support is going to be impossible. And so thinking how we as a state support those families and those educators is going to be important. And I am seeing some great notes here about this.
Yes,
great.
I'm going to just jump in quickly. I keep the conversation going in the chat, definitely. Michael and I, and probably a few other partners on this call, have been partnering to try to get clarity, which, as you know, changes every day, and identify the banks that have been friendly to people who don't already have, or organizations that don't already have accounts with them. And that's part of the work that we're hoping to do together with some folks on your team as well. But thank you, because the points that you're highlighting about how philanthropy can help leverage relationships and what are some of the alternatives and how philanthropy can step up are incredibly important points here.
Thanks. And I'll just add quickly, this is an email that I received this morning from a national partner who wrote, in particular, banks are rejecting applications unless providers have a separate business checking account, an EIN, and a DBA registered with the state. Getting all of these is not a big deal, but banks won't accept them unless they already have this before they apply. One provider had a long banking history, $38,000 in personal savings, and the bank wouldn't change their policy because she didn't have a separate business account. So just a quick story to give you a sense.
Yeah, we're finding some of the smaller banks are able, that are newer and have more updated technology, like New Haven Bank or Liberty, have been able to work a little bit more flexibly. But these are really important points. So anything that anyone wants to put into the chat we need to be able to have these centralized locations to get the information out quickly to the business consultants and others who will be partnering with all our can. With that, I want to make sure to turn it back over to Jen and Jessica, unless there's something. Okay, I think can turn it back over to you guys to continue.
Jessica, this was really helpful context. And again, this is a very dynamic situation. So I think we all, just increasing our awareness of what your needs are and where you are right now is helpful to our work. You mentioned a number of different dimensions where family childcare providers need more support: economic stability, help supporting their physical well-being and the well-being of the children in their care, supplies, information and navigating sort of the options that are available to support them right now, and also mental health counseling and support. Would you be able to break down a little bit sort of like who's doing what and where the residual needs are? So, what is being done at the state and federal level right now? What are you as a provider or a supporter of provider able to do, and where do you see the gaps still remaining?
Yeah, so I think one critical need is just short-term financial support for family childcare educators, which is one of the key reasons we've started our emergency relief fund. Even where there will be dollars forthcoming at the federal level, those aren't going to come in right away. And so really trying to get dollars into people's hands to meet short-term emergency needs, I think, is a top priority for us. So through our emergency relief fund, it's not huge, but we're hoping to get, between $400 and $500 into each of these small businesses. And we think that can make a huge difference in the short term. We also, some of these loans are forgivable and some are not. Family childcare programs are really small businesses with razor thin margins. And so grants versus loans, I think, are critically important. This issue of health and safety and medical supplies is so important, and unfortunately is not just an economic challenge, it's also a challenge with finding the stuff. So I would urge everyone on this call, if you know of a supplier who can offer any of the things that educators might need, again, from things like disposable thermometers, gloves, paper towels, hand sanitizers, bleach, please, if there's any way to get those things to us so we can distribute them to these small businesses where children are coming every day, right? Children from the families who are probably at the greatest risk of exposure. I think that would make just all the difference in the world. I also think for philanthropy to think about, again, how to support people who are going to fall outside of the current relief systems, like those that don't have documentation. I would really love to see a push around that. And finally, we see so acutely how families are struggling with access to the most basic of needs. I know this is part of what 4CT is working on, but food insecurity in the state is really so high right now. families struggling with issues of being able to, keep the lights on, just keep their family provided for at the most basic level. I think investing in basic needs is so important, and making sure that organizations like ours and other intermediaries know about what is available, because there's a huge gap in what's out there, and the information on where to find it is often missing. So those are some of the key things I would prioritize.
That makes sense. Sky, should we pause briefly? Do we have other questions or?
I don't think we have other questions. Rich and Dorothy have been putting in some helpful information about the Fed announced today that they will share risk with banks on the SBA loan to help address some of these problems. And then Dorothy has made a suggestion about doing a call out through SVP and 4CT on those supplies. So I think that would be a great conversation to have. We can put a pin in that. I think it's definitely one of the things we would want to highlight at the end of this conversation as a potential action item. So thank you.
That would be amazing, amazing.
I do think there is a current proposal that's being submitted to 4CT that does call out a lot of this, Jessica, including the supplies issue. And I think you've been in conversations with Beth about putting that together. So yep, this is being elevated that way. So that's, but I do think there's a lot in our network too that if we can get the word out, Sky, that we should be able to find access to some of these supplies as well. So.
That's great. To the issue around health and mental health consultation, this is something that we are really hoping the state will be able to take on and provide. And we've been talking with Beth a lot about the need for this and why it's so critical. So I'm hoping that this is something the state will be able to rally around. I don't know if they will need philanthropy support in order to make that happen. In the meantime, we're gap filling both with volunteers and with our own team. But again, this is something we'd like to see statewide, and ideally would be embedded into the OEC, the Office of Early Childhood's approach.
Right, and maybe that's a good point to sort of think about and reflect about some of the possible sort of silver linings in all this, because I can see how setting up some of these systems, such as like the behavioral health counseling support system for providers, could be something that would have lasting benefits, right? Like, I mean, that's something that's probably a need already. So if we can sort of, get that going and structured now, that could be something that helps us for some time to come.
Yeah, and I do think, I mean, to the extent there is a silver lining, I think there is an awareness now of both the importance and the fragility of our existing childcares in a way that I have never seen before, in part because the system is in such jeopardy, in part because childcare is front and center as we think about what it takes for healthcare workers to go to work every day. I think that's changed the conversation. The last piece of it, as a few folks have commented, is that with children home across the country, every parent sort of has in their face every day how much their childcare provider helps him or her to do his or her job. So I think there is a moment there to really push for and advocate a different kind of fully funded system where childcares aren't operating on such thin margins, where they have cash reserves to sustain a 3-month closing, where they know that their businesses can stay in operation. But the other piece, which I think really speaks to Richard's question, is that having good systems of consultative support to childcares, particularly family childcares who can't afford to pay for it, is something that we've been advocating for at All Our Kin for a very long time. So it seems to me to be truly a public health function to have trained nurse consultants who provide advice and support to programs. We ourselves have a small early Head Start program where we have such nurse consultants, and what they are able to offer in terms of ensuring that children have immunizations, are up to date on well visits, dental visits. I think the return on investment, the savings to the state overall, would be enormous, not to mention the deep and lasting benefits to children and families. But nurses play a dual role, right? So one part is actually making sure that children are well and get what they need. The other, which is probably more relevant here, is around good health and safety practices. And so here for them to really be training family childcare educators around how to screen families. For example, in current conditions, you should take the temperature of everyone who shows up at your door, not just the kids, but the parents too. What does that look like? What does your cleaning look like? How are you engaging with children in a way to most protect your own health and the health of the children? And how do you know when a child has symptoms or is sick, or when you and someone in your household might present a risk to children coming in the door? The mental health consultation, we actually do have a statewide model for doing this. And Walter Gilliam at Yale has demonstrated the profound effects on things like, for example, preschool expulsion rates of having mental health consultation support. So these are experts who work with teachers and educators to help them be more reflective, more perceptive, and more responsive to children's needs in the moment. They can also advise on children who are exhibiting specific behavioral issues because of tough situations in their own lives and how to support those kids. So again, our own coaches have a great deal of expertise in this and can provide much of this support, but it's also great if we can draw on some of the statewide systems that are in place already and really plug them in. Again, as someone flagged, using telemedicine to provide this consultation. So there is kind of a statewide system for doing both of these things, but it's not sort of ramped up and ready to go, but it certainly could. From the nursing perspective, I think it would require more build out. Probably what you'd want to do is fund existing networks like All Our Kin to draw on the expertise of public health nurses, something like that.
Thank you, Jessica. Maybe just one more question and then we'll open it up to the group. And it's hard to separate this question from this current crisis, and you've kind of alluded to the answer already, but knowing that there's so much good work being done in early childhood in Connecticut right now, what advice do you have for SVP, or what recommendations as to how and where we can help both now and in the future?
Yeah, so I think, you know, SVP is uniquely well positioned to help groups like ours and others think about a couple of things. So one is, you know, there's been a lot of talk about how not only is the childcare system under threat, but nonprofits are under threat. So really providing potentially emergency guidance and support to nonprofits who are having to scale back, cut staff, make very, very difficult decisions during this time. Just help them think through and prioritize that. And there are many pieces to that. I got an email from the management center that really made my blood run cold, but it was about how all staff of essential organizations like ours should have a backup plan in place for who takes over their work should they become incapacitated by the virus, right? So all kinds of things that small nonprofits just don't have. The second, I think, is that SVP does have so much leverage and reach, both with government and the business community. So ensuring that government, that our state government, I think they're doing in some ways a really good job, but really think about who's left out of the current relief efforts. What role is our state going to play in including those who are not part of the current initiatives? And again, I hate to keep bringing this up, but folks who don't have documentation, there are states like California that are taking this on as a statewide responsibility. There are also places where the way state systems are set up are just going to exclude the self-employed and small businesses who are disproportionately led by women and people of color. So here's a great example. Under pandemic unemployment assistance, self-employed people are eligible for unemployment assistance. But if they go into the Department of Labor website right now, it's going to spit them out because it's not set up to recognize self-employed people, right? So thinking about some of those pain points. And Dorothy, I can tell that you've been thinking a lot about this a lot, which is really great to see. I think that another great role for SVP is mobilizing philanthropic efforts through things like 4CT. I can envision, you know, in our very fractured and divided state, an approach where there's a lot of money flowing in to a few communities and a lot of folks who get left out or left behind in sort of places where our network of support just has gaps or doesn't have the same kind of philanthropy on the table, you know? And so really making sure that the work that we do as a state, and we think about how everyone in the state is able to weather this very tough crisis. So I think those would be at the top of my list. I also think, again, just in terms of positioning our state for economic recovery, this issue of how essential childcare is and what it's going to take to get the businesses that we've already lost up and running and make sure that we're ready to get going on that right away, I think is really going to matter.
Jessica, this has been fantastic. These are a lot of really important ideas, and this has been really interesting and informative and provocative. So thank you so much. And I know that there are questions for you, so I'm going to turn it over to Skye to
Thank you.
let people join in.
Yes, people can keep adding. We've had some great conversation in the chat. I believe we've covered, and I know, Jessica, you were keeping an eye on it, so thank you. You were able to answer some things in real time. One question that Mark asked was about, can all our kin work with a bank to quickly create a program to sign up family providers with business accounts?
That's really interesting. I mean, I think that is a super idea. That's actually a great SVP partnership question. Because my guess is you may have some more robust relationships than we do. And maybe we can talk about it offline, Skye, because I know you are talking with Erica and our business team,
Yes.
if this is something that we could look at doing.
I think it's a great idea. Thank you, Mark. I mean, leveraging the types of relationships that we have with banks and with potentially with businesses and manufacturers is a key thing that I highlighted here. So we'll definitely continue that conversation.
It's funny you said that, Skye, because I just sent an email to you and Jessica with that very idea.
Excellent.
I've been talking with Carol Heller, who heads up philanthropy for Bank of America, and she wants to do something on childcare. And I suggested that they do a group program with all our kin, in mass signing up, family childcare providers for business accounts, and then kind of they can apply for the PPP program. So we'll see what she, has to say on that. But it's a very concrete thing. They're trying to figure out what they can do in the childcare realm. This is a very concrete thing they could do right now. That would be very, beneficial.
That's phenomenal. And I just want to respond to the chat because I see there is a new program that looks really useful from DECD, and I want to lift up the note, which I think is from Dorothy. I mean, loans are great, and one reason the PPP is attractive is that it's a forgivable loan if you keep people employed. Again, these are folks on razor thin margins, and for many of them, they're just worried that the loan might get them through, but then they won't be able to repay and keep their business open. So anywhere that we can look at grants instead of loans, or loans that are forgivable, or convert into grants, I can't say enough how challenging it's going to be for folks to pay even the most generous loans back.
And I will, I don't see any, I see some updates that Camille is adding here, but I'm scrolling through, don't see any new questions. I will put a plug in here. The people who have signed up or are interested in signing up to help small businesses, such as the family providers, that Jessica is referring to. We are meeting this afternoon at 1 o'clock with Marjorie, and we have an SVP partner who is an expert on loans who will be providing some training so that we can, and we'll be continuing to look at the guidance as it changes and keep us updated so that we'll be able to rapidly help and support. So if you're interested in that, maybe based off of this conversation and see it as a way you'd like to help, please reach out to me or to Marjorie to let us know, and we can get you wrapped into that training at 1 o'clock.
And Sky, could I just ask, there's so much great stuff in the notes. I don't know if you can transcribe from Zoom or, but I would love to get a copy of these notes afterwards because there's a lot of great stuff in here.
There's good things here. I'm hoping that the recording that we're doing will also record the chat. I'll find out. And the great stuff that Camille has been copying in here, I know we'll be able to get that from her.
Okay,
So,
great.
It looks like, yes, we can copy this into a Google Doc.
Great. Okay, super.
I want to be, I know that we really want to be respectful of your time. We told you about 30 to 40 minutes. And I think we've had a really robust conversation in this amount of time. Does anyone have a final question to send in to the chat? You can do that now. Otherwise, we will be kind of letting you go, although Jessica, you're welcome to stay for the 15 minutes. I think we're going to, what we're going to do is identify, what I heard were 4 or 5 key things and that SVP can do. One is at the more of the systems level, looking for banks, looking for businesses and manufacturers and leveraging our relationships. Second is around supporting access to funds for the small businesses, the family child care providers. Third is around elevating the need for people who will be left out, people without documentation, who will be left out of the stimulus checks and the loans as they stand today. And another is around mobilizing philanthropy and looking at statewide efforts. I know that there were, so those are 4 that I've highlighted that I think we'll be discussing next. You brought a whole lot of incredible ideas, and I'm glad that this is recorded because I'll be able to go back to it and find it for ideas. But thank you very much. I don't see any additional questions, so I think we can let you go, although you're welcome to stay for further conversation. But we really appreciate your time today.
I will sign off. I'm so grateful to have been part of this and so grateful to all of you. Thank you.
Thank you.
Bye-bye.
Bye.
Thank you, Jessica.
Thanks. Bye-bye.
Okay.
Thank you, Jessica.
So I'm going to unmute everyone. I'm actually going to stop the recording right now.